Hey guys, it's Dr. Ashley from ProfessorAshley.com. How are you all? I'm back with another question from another student slash viewer. And well, first of all, don't I look like someone who is sitting in a winter log cabin in the middle of the woods, like in the middle of nowhere? Well, the reason for that is because this is an Airbnb. This background, this is the kitchen, and I'm in one of those really cool, super old French houses in downtown New Orleans. And right now it is super cold, very, very cold. It is below freezing outside right now. And so these old houses don't have central heating. So I'm cold, very cold. And that dripping you hear in the background is the faucet, because we had to turn on all the faucets to keep the pipes from freezing. Anyway, back to the show, back to your question. So this next question, it was asked a couple of times in the comments on a few videos, and I wanted to go ahead and address it to you guys, because it seems to be a concern amongst you all students out here trying to figure out exactly which master's degree program to get into. Okay. So the question is, what is the difference between an MHA and an MPH? Okay, so an MHA, let's go over that one first. An MHA is a master's degree in healthcare administration. All right, so this degree typically will focus on the management and administration of healthcare organizations, and it is going to cover topics like healthcare finance, healthcare management, healthcare HR, healthcare laws, policies, regulations, leadership, healthcare quality and performance improvement, strategic planning, marketing, things like that, right? So basically everything you need to know to be a professional at running a major healthcare organization. All right, think of an MHA as like an MBA, but for healthcare. So it's like you're studying the business of healthcare so you can run a healthcare business. All right, so that's just like the basic idea of it. Now, typically, if you're going to get an MHA, you're not going to be someone who wants to go out there and fight for the people. You're not someone who wants to work in government or nonprofit organizations. I mean, you can be, yes, but usually the people who get these degrees are people who want to work for-profit organizations within healthcare. They want to hold high-level executive, positions within a major healthcare organization or healthcare facility, and they want to run it. They want to be part of the business operations. Okay, maybe they're going to work in the finance department at a major hospital chain. Maybe they want to work in HR at, a major hospital chain, or maybe a pharmaceutical company. Pharmaceutical companies are huge and they make tons of money. Well, they have to have people who have MHA degrees to run their major business operations. Okay, it's not just one person that does this. It's a ton of people who have these degrees, and they're going to work in different departments within, the business. Okay. And many of those departments have to do with finance, marketing, HR, leadership, quality improvement, research and development, things like that. So you would typically be working there, but you're not going to be the one doing the work. You're going to be the one coming up with the systems and doing the coordination and, managing the people who are working in those departments, and making sure that that the flow is going, and then everyone's doing their parts, and they're all managing, doing the work in the business accordingly. So you are more of a manager or a leader within those departments. Okay. I hope that helps. Now let's look at the MPH. What is an MPH? An MPH is a master's degree in public health. Okay, so a master's degree in public health is going to focus on the promotion and protection of the health of the population. What does that mean? You're gonna, when you're in school, you're gonna cover topics such as epidemiology, biostats, environmental health, health policies, yes, same thing as MHAs, but you guys are going to be looking at health policies and laws from a different perspective. So an MHA student would be looking at the laws as like, how can I, make sure that my business that I'm running is, acting in accordance with the law, so we don't get in trouble and we don't get fined. But at the same time, how do we skirt around certain areas, right? Let's just be honest, that's what you're going to be doing. But if you are someone who has an MPH degree, you're someone who works in public health, you might look at health policies and health management as from the perspective of, we need to create new laws to help facilitate the health of our populations, right? So you're going to be looking at a lot of global health, a lot of population health within your counties, in your country, in your cities, and your state. So typically, someone who gets this degree is going to be working for probably the government or a nonprofit organization, usually. And the goal here is to protect the communities, or to, work and maybe, protect the communities. Overall, protect the communities. Your focus is the health of the populations, depending on what level you're working at. So you could be working for just the city, or you could be working for the state health department, or you could be working for the CDC, or you could be looking for a job within the WHO. Okay, that's more global health, the global health community. CDC would be more national. And then, your typical health departments in your local county and city. And then obviously there's the state health department as well. So that's really the difference. Depending on where you work, you're gonna, typically when you work for the government, you're going to start at more of an entry-level position. And after you've worked for, a certain amount of years, then you get to move up in ranks. And it's more of a, they typically don't look at, you don't really move up in government according to how, well you work or how much money you bring in and whatnot. That kind of a thing, the ambitious person who's out there trying to make money for the company, those people are going to be the ones who work for the profit companies, the for-profit companies, usually the MHAs. That's where you want to go. If you're someone who cares more about the health of the community, the MPH is where you want to be, and you're not going to be moving up in the ranks. When you do good in your job and you save the company money, or you make the company more money and you make deals and you do all these things, that's not how you move up. You're going to move up depending on how long you've been working for the government. Okay. Typically that's how it is. And of course, just make sure you don't have any complaints against you. Working for the government isn't too bad. Once you get in, the government jobs have so much job security, it's not even funny. Okay, you don't have to be the best worker. You don't have to be that ambitious. You don't have to want, all of these. You don't have to like want to do so much for the company. It's really just get your job done. And here's your salary. Here's your health insurance. There you go. Now, if you're working for a for-profit company, it's more of, things happen a lot more fast. It's fast paced and it's win-win-win. It's a bit more competitive, but the money will be higher and benefits will be different, and obviously you can move up as fast as you want to go. If you're highly ambitious and you have, you just, it's go with you and you just achieve. Or you could just be, a worker that doesn't do that much. And then eventually you'll probably just stay where you are, or you might be the one that gets laid off if they have major layoffs at those companies. There isn't too much job security if you're in that type of an environment, but there's more money and there's faster mobility. Whereas if you're working for the government, it's going to be very slow mobility, but it's stable. Okay, sturdy, stable mobility. So MHA, fast. You're working for-profit organizations. It's business of healthcare, business, profits, right? And competition, and things like that, right? And then MPH, it's the health of the community, the health of these populations. Work for the government, stability in your job, benefits, healthcare, health insurance, and slow but steady mobility. Okay, so I hope that answers your question. I hope that kind of clarifies the major differences between getting either or degree. That being said, if you get an MHA, you can still work for the government. And if you get an MPH, you can still work for not a for-profit organization. It's just, you can work your way through and, make it happen for yourself. Of course, there's no rule against it. It's just that's not what they're looking for. But, anyways, I hope that answers your question. And I know I kind of made it a little confusing in the end, but all in all, it's not navigating healthcare and, non-clinical workers, more clerical and business-oriented workers. It's not as black and white as it would be if you are like a nurse or a physician. So that's why it kind of gets a little confusing and it's not, it's not too straightforward, but for the most part, I hope you get the gist of the difference between the two degrees. So I hope that helps. And I will talk to you guys later. Please ask me more questions to answer. And also, please check out the website. There are resources. There's plenty of articles that might be helpful to you guys. And there will be some guides coming soon that you guys can use to help you navigate the healthcare system and also getting a job. There's also a service that we provide where we will write your cover letter and resume and guarantee that it is going to rank on the ATS system, and you're very highly likely to get an interview. Can't guarantee you're going to get a job because that's, at a certain point, it's up to you. But you will be a whole lot likely to start getting more interviews with what we can provide you. So please check it out and let me know your thoughts, comments, and questions in the comment section. I will check you guys out later, or I'll talk to you guys later. I'm not going to check you guys out. That's weird, but I'll talk to you guys later.